we have this natural, wonderful symbiosis with our gut flora. Keeps us alive, keeps us healthy, but if we damage it, we pay the price.
Candida. If you're not optimally healthy, could it be devastating your health? Hi, this is Dr. Mercola helping you take control of your health, and today we are joined with Dr. Leon Chaitow, who's written a book about this and will help us understand the details of the dangers and what we can, more importantly, what we can do to correct this infection that's so common in so many people. So welcome and thank you for joining us today.
Thank you for having me.
So perhaps it might be best to start by explaining what your training is and where you reside and practice, and then what motivated you to focus on this as an area of your personal interest and clinical interest.
So I'm trained as an osteopath, naturopath, British trained, and practiced in England for 30 odd years before moving to Greece, where I live now. I live both in London and in Greece. In the mid-1980s, I began to notice a change, or not a change, but an increase in the number of patients who were coming to me with symptoms that I had not recognized as being as common as they had become. There was an increase in digestive gut problems. There was an increase in yeast-related illnesses that they were reporting skin problems, vaginitis, and fatigue was a major feature. So I was really concerned about what was producing this change in my patient population. And it was at that time that I came across Dr. Crook's book on the yeast connection and read it, and it illuminated the story. I began to understand what I was dealing with. And I contacted Dr. Crook, and we communicated. And it's from there on that an evolution in dealing with the yeast. Let me just go sideways. When I've got, in my practice, had a problem with understanding fully the nature of what I'm dealing with, I tended to try to write about it, either an article, a journal article, or sometimes these ended up as books. So what actually happened as I explored the yeast connection, I had to put my own take on it, my own spin on it, if you like, as far as I was seeing it in the United Kingdom. And what happened then was, by synchronicity, a publisher asked me whether I'd be interested in writing a book about my work. So the book that you mentioned is the fourth edition of that book, which came out in 1985, and it was then known as Candida. Could yeast be your problem? And it's very much the question you asked at the beginning of our talk. And as that evolved, I began to see the link with chronic fatigue syndrome, with patients who had chronic pain problems, with fibromyalgia type symptoms, and that led me on to other things which we may get to explore. But basically, my interest was triggered by patients and then illuminated by Dr. Crook, and then resolved, if you like, in terms of how to manage the condition, at least at that time, by exploring all the options, and that came out of writing the book.
Great. Well, Dr. Crook's book was also really instrumental in my personal journey into natural health, and many people may not know this, but I'd like to share that story now. I read his book in 1985, which was the year I finished my family practice residency, and started my practice outside of northwest suburbs of Chicago. And I was one brainwashed doctor. I bought into the pharmacological model, hook, line, and sinker. So I read his book, and I clearly, like any physician, you're going to have patients that exhibit these symptoms. They're pervasive, as we'll get into in a moment. So I tried his approach, but because I was so brainwashed, I thought the major purpose was to kill the yeast, so I prescribed antifungals, never addressed the diet. And guess what? It never worked. So I let that go and fester for about 6 or 7 years. It wasn't until the maybe late 80s, but early 90s, somewhere in that frame. And I had another patient that came in who was a small child, had this chronic diarrhea and was exhibiting some signs of autistic spectrum disorder. So I said, well, but it had the classic signs that Dr. Crook describes in his book. So I said, we'll try it this time. And for some reason, I'd grown somewhat and became more knowledgeable about nutrition. So I said, let's do the diet interventions too. And lo and behold, of course, it worked like a miracle. And I with my eyes were opened, and it started me down the path. I went in the back with his book, and looked at physicians that I could connect with so I could understand this more. And that eventually started my journey towards getting postgraduate education in natural medicine, and then in my voracious reading, and that started the path. It really did. So I'm very, very grateful. Unfortunately, Dr. Crook passed away a number of years ago now, but his work continues. So let's go back to what the issue is. We know how instrumental it is to both of our clinical practices. But Candida albicans specifically is a yeast that's pervasive. Basically everyone watching this has it in their system. But if your immune system becomes disrupted from lifestyle, exposure to antibiotics, poor dietary choices, improper sleep, or any combination of that, then it becomes disrupted and it becomes just grow out of control. So maybe you can expand on that nugget at the beginning so people can begin to have an appreciation of the problem.
Yes, I can, I can try. The issue seems to be a mixture between modern lifestyle and diet, so it can be a range of features that lead to some degree of immune suppression, depression, not in the extreme sense, but simply not functioning well enough. What seemed to happen at the same time that I was becoming interested, which was the mid-80s, like yourself, in this almost epidemic of symptom picture, was the link with the, as you say, antibiotics and other hormonal products seem to be getting more and more prescribed. So we had both medication, which was producing problems, we had lifestyle that was producing problems, and the issues seem to initially start in the gut. That seemed to be the heart of the matter. Now, we all, as you say, have yeast in us. So that makes diagnosis a little bit problematic, because you can do a stool analysis, look at the content of yeast, and it can be quite high, but there could be no actual problems. That could be in quite a healthy individual. It seems that the change in the gut flora, which can be the result of antibiotics, it can also simply be a nutritional high sugar diet, high refined carbohydrates factor, leads to this change in gut behavior, where the yeast can change because the normal flora of the gut produce biotin, that's your normal healthy flora, and the biotin suppresses the ability of yeast to change into a more aggressive mycelial form, where it can actually put down little rootlets, penetrate the gut mucous membrane, and start a process where we start to absorb toxins from the gut, and we start getting sensitivity, allergic type symptoms, body-wide. It can be pain, can be fatigue, can be many other things. So the change in the normal flora seems to be the key to correcting the problem, because they normally keep yeast under control. Yeast is there, but it's not aggressive. Once we lose that, the functionality of the normal gut flora, the problems accelerate. So that was my focus then, was to how do we enhance the gut flora, what diet suits them best, and we can come on to that, and how will that control the yeast. Rather than killing the yeast, we need to, if you like, starve it and suppress it naturally, the way the body normally does.
Yeah, I like the way you phrase it in your book, that it's really in normal, as you just mentioned, normal flora, and it's not necessarily a pathogen, but it's an opportunistic infection, and really can be viewed properly as a parasite and and a freeloader that takes advantage of your mistakes when you fail to implement a proper lifestyle or are exposed and buy into the medical paradigm like I did 30, 40 years ago, hook, line, and sinker, that drugs are the solution. That very frequently these drugs, the antibiotics, the steroid hormones, the oral contraceptives, when you're taking these, it changes the internal environment that predisposes the Candida to grow into this more invasive form of infection that can really cause some problems.
Yeah, that summarizes it beautifully. And the formula that I try to have as an overarching approach to all of these chronic problems is to try and simplify it to enhance immune function, whichever way you can, reduce the adaptive load that you're imposing on the system, so it can just be better lifestyle, better sleep, more exercise, improved, enhanced diet. So stop feeding the yeast, stop damaging your immune function, and replenish the gut flora as best possible, and that's something we do a lot of. And the yeast controlled takes care of itself. You don't have to kill it. There are times, and I have personal experience of that. I had an injured cut. I had a cut in my foot last year from stepping on some broken glass. It became infected. It actually became a bone infection. I had osteomyelitis. I had to have high-dosage antibiotics. They saved my leg. I have my leg, but I also had the after effects of the high-dose antibiotics, and that's dealt with very neatly by probiotics, prebiotics, and probiotics, symbiotics, getting the gut flora healthy again. So it's not like we can be anti-antibiotics. They save lives. They saved my leg. It's about how can we deal with the repercussions of that, and how can we prevent it from affecting us when antibiotics are used unnecessarily, and as you said, oral contraceptives and many other hormone derivatives, sometimes used appropriately, but always going to have this negative effect on control of this always present yeast. I mean, it's like we have this natural, wonderful symbiosis with our gut flora. Keeps us alive, keeps us healthy, but if we damage it, we pay the price.
Yes, indeed. So the intention of this dialogue is not to unnecessarily alarm or instill fear in people, because if you're living a healthy lifestyle, the likelihood that this is going to be an issue for you is very remote, highly unlikely. But if you're not, and you're just seeking to enter into this healthy lifestyle, then it most likely is a challenge for you. And I can tell you very simply, one of the major clinical symptoms that I notice in people is when they stick their tongue out. And if it's not pink, bright pink, and coated with white, because usually Candida is clinically, when you see it in large populations, is white. So if you have a white coat on your tongue, yeah, that's a major sign that you have some issue. But I'm wondering if you can describe to us some other symptoms that people who aren't living a healthy lifestyle might be alert to that can signal them. Because as you mentioned earlier, a simple stool culture is not going to be very helpful here. We really have to rely on the symptoms.
Well, I think it's people who report, as they often do, that they are sensitive to certain foods. They're reacting to certain foods. They may, in fact, be reacting to wheat or dairy foods, but that's unusual. It's when people start to report changes in what they are having negative effects from in their diet, or they're getting unnaturally fatigued, or the unusual aches and pains which I associate with muscular rather than joint problems, and which are, again, appearing for no particular reason, especially if this is in the female. It seems to be a more female gender issue, especially if they've been on oral contraceptives or had 1 or 2 or 3 prescribed antibiotic courses in the last year or so. Then, so it's like, and gut symptoms. It's unusual bloating. It is perhaps not an irritable bowel, but sometimes constipated, sometimes diarrhea. Changes in normal gut function, changes in fatigue, changes in pain symptoms, and odd skin issues, which can just look like dry patches. And obviously the vaginitis type symptoms, because this is the most common manifestation in young women, is inflammation of the genital area. So all or any of those might set the alarm bells ringing, and that's when often patients would come in. I remember a phrase that Dr. Bland, Jeff Bland, used when I worked with him some years ago. He talked about people being vertically ill. They weren't sick enough to lie down. They had a catalogue of symptoms. They were still walking around. But like most of us, or like many people, they had 2, 3, 4, 5 symptoms, which they shouldn't have, and they couldn't explain it. So it's the unexplained symptoms, no obvious pathology. That's what I would look for.
Great. So assuming you have it, clearly the very first step is to remove the factors that contribute to the growth of this organism. And we went over them again, but let's repeat it because repetition is the key to learning. Antibiotics, only take them if your life depends on it. A subcorollary of that is avoid the antibiotics in almost all confined animal feeding operations, or CAFO meat products. That would be beef and chicken primarily, and pork. So stay away from those because they're loaded with antibiotics. 80% of the antibiotics used in the United States, at least, are in agriculture. So and then so the antibiotics, then the hormones, and the unnecessary contraceptives, and sugar. You got to clean up your diet. You can't have sugar, and ideally, it's a diet we talk about on the site: low in net carbs, high in high quality fats, and moderate protein. So that's key. And you're doing all those, and maybe you can mention some more, and then to round out that process, and then we'll talk about potential other interventions, including pharmacologic and then natural therapies. So what other recommendations would you recommend they can do by themselves without anything else other than the ones I mentioned?
Yeah, I think you're absolutely right. The diet is the key, and the diet needs to be as unprocessed as possible. I live in Greece half the year, and the Mediterranean diet is the ideal one. It's fish, not farmed fish if possible, fresh fish, lean meat if it's from a non-farmed source. And now if someone can come with organic meat, that's a different story. Most of it is not. The agricultural industry is a main user, as you say, of antibiotics, and that's where we are most at risk. So the dietary changes are very simple. Mediterranean type diet, vegetables, fruit, not too much of the very sweet fruits at the beginning of an anti-Candida program, but certainly fruits like papaya and so on are wonderful. The avoidance of anything that is going to provoke fermentation. So sugar is the key to avoid. And at the beginning, that even covers things like honey, and in the first month or two of an anti-Candida program. So I think it's quite a simple process. It's healthy lifestyle, healthy diet. The program has to be coupled initially by trying to encourage more normal gut flora. So we go straight into the prebiotics and probiotics. That needs to be accompanied by change in diet and avoiding antibiotics wherever possible.
Great. Yeah, there's no question that's going to be an important component of it. So I think the next step, once you've integrated these lifestyle changes into your program, that is to consider how serious the symptoms are. If they're still persistent, are you a candidate for drug therapy? Now, as I mentioned at the beginning, what I thought was going to be work so wonderful failed miserably because no one implemented the lifestyle changes. So that would be, I think I prescribed diflucan at the time, or fluconazole, which was not necessarily recommended in Dr. Crook's book, but what I want to discuss with you, because you've got some extensive experience in this, and I played with this for a while, and I never really came to a firm conclusion, but Dr. Crook recommends nystatin, which is available as a powder or tablets even, but typically powder or suspension that you would swallow in relatively high doses. And it's a relatively benign drug, relatively few side effects, and seem to be useful. But I'm wondering what your experience with that is, and if you have any recommendations about people using that, or even some of the more potent antifungals, the pharmacological ones, as part of the comprehensive program to treat resistant infections.
Yeah, I've used nystatin over the years as a fallback. I try to avoid using antifungals unless the condition is not improving at a reasonable rate. I think that there is an argument for using nystatin. Diflucan is another one I do use, that type of antibiotic, but I use it as a fallback position rather than as a starting position. And initially I try to get the tilt towards control of the yeast via diet and probiotics. And I can't argue the case for starting with antifungals. I think I use them, as I say, only as a fallback position. And over the years, that has been that has proved adequate. If people have the patience, there are issues about cost here, because sometimes a comprehensive antifungal program becomes somewhat expensive. You've got a number of nutrients and probiotics and so on to buy. Some of the food is more expensive if you're buying organic meat rather than the normal processed meat, and so on. So I think people have to compromise at times. I think using antifungals, unless there's an extreme fungal infection that demands rapid resolution, I think, and unless there's an economic imperative, I would try to think of it as not last resort, but certainly second resort. Primary is diet and lifestyle and the associated probiotics, and there are many, many botanical, herbal type products which can assist in that process. So I'm not sold on always using, or even 50% of the time using medication.
That's good to know, and that's basically the position that I reached after trying that. And the reason I had taken a more aggressive position with that is Dr. Crook's book, as you know, highly recommends that as an intervention. It seems for almost everyone. So, but I think your more conservative application of using it as a fallback position makes a lot more sense. And that's a lot of times what it all boils down to is common sense. So getting back to the dietary interventions, and I neglected to mention my perspective on the fruit, because that was really a key when I was treating patients clinically with this, is to restrict all fruit in the initial stages, and as they improve, they get better. Now, I've learned and grown since then, and my newest passion is recovering health through improving mitochondrial metabolism. And basically that involves people shifting from almost everyone watching this, and most of the people in the world are burning carbohydrates as their primary fuel, which is a dirty fuel, creating a lot of reactive oxygen species and secondary free radicals, and shifting over to the point where you can metabolically burn fat as your primary fuel. And once you've made that shift, which can take several weeks to several months, somewhat similar to the shift that occurs in treating Candida, then I think fruit becomes a viable option. But until you're making that shift, I think it's highly counterproductive to have a lot of these fruits. But so I think that it kind of goes hand in hand. That's my evolved position on eating fruit. But even then, you have to be careful. You can't overeat it. I personally have about maybe 80, 90 grams of net carbohydrates a day. So that might be 200 grams of carbohydrates. So that's what I would do. But do you have any responses to that? And then we can talk about some of the probiotics, fermented vegetables, and then the herbal interventions, or not herbal necessarily, but supplements that might be useful for this.
Yeah, I'm not. My direction has taken a different one from yours. This biochemical or refined attempt to modify the way the body functions, the mitochondrial function, and so on. It fascinates me, but I have not gone down that route. I got diverted from there, and so I can't really speak to that. I have a far more pragmatic approach to the use of fruit carbohydrates in general, which may well need revising. I may need to do some studying of your work more than I have done. That I proscribe fruit in the initial stages. I then allow the less sugary type fruit, like I mentioned papaya, in increasing quantities. I think by the time I get someone has got 3 to 4 months into a reformed program where Candida is then under control, or seems to be, I don't limit their fruit in particular. So I think we may have to slightly disagree on that.
Okay.
Not disagree, but I'm just not there.
I just don't think you've been exposed to that literature yet. But when people are struggling with far more serious diseases like terminal cancer, heart disease, heart failure, neurodegenerative disease like Alzheimer's or Parkinson, then you have to get a bit more aggressive, and that's where this conversion to optimization of burning fat for your primary fuel becomes really crucial. And anyone who's actually interested, like myself, in longevity, I'm pretty healthy, but I'd like to stay around for a lot longer, maybe another 70, 80 years. And the only way to do that is optimize your health so that you stay healthy long enough to take advantage of some of the technical improvements that will allow us to do that. So, but getting back to the probiotics you mentioned, I think they're crucial, probiotics and prebiotics. One of my favorites is fermented vegetables. In fact, I personally don't take any probiotics. I use high-quality fermented vegetables that literally have 10, 100, 1,000 times more viable organisms, beneficial organisms in there than the probiotics do. So I think that ideally my strategy is to get it from the food rather than to take a supplement. I think that's useful. So maybe you can come on that, and then we can talk about some of the other strategies you can use, which are natural approaches, and not necessarily supplements, but extracted from nature, things like Peruvian tree barks that you can use, and aloe and things like that. So let's talk about the prebiotics and fermented vegetables for a bit.
Yeah, the prebiotics, fructooligosaccharides, which are taken to enhance the functionality of the normal flora, that can be taken as a powder. I absolutely agree that fermented foods are the ideal. It's sometimes a shift too far for people in the early stages. It's completely outside of their culture. It's something that I try to introduce when I can, but simplicity seems to be, look, I'll start from a different place. Compliance with a program is always going to be difficult. The more complex it is, the less likely you are to have a patient comply, to fulfill what you're asking them to do. The essence of compliance for me is the patient needs to understand the why. Why are you asking me to do this? You're asking me to stop eating this. I like this stuff. You're going to ask me to stop it. Now you're asking me to do something else. And fermented vegetables, for God's sake? No. A simple program where it's take this powder, which is a prebiotic, once or twice a day, take these either powdered, preferably powdered, or encapsulated probiotics, and one or two other things. The more complicated it is, the more expensive it is, the more difficult it is, the less likely you're going to have compliance. And if you lose your patient because they just find it's too much, either too expensive or too complicated or too unpleasant, then you've not gained anything. So it's about simplicity for me, and I use the prebiotics, probiotics that come in a simple, easy form to take.
Yeah, compliance is a big issue. There's no question. You can't, it's basically indisputable, because if people are just going to give up and abandon your program because it's too complex, then what good have you done? With respect to prebiotics, though, I'm not necessarily a big fan of FOS, fructooligosaccharides, because I think it's been reported in the literature that that can actually cause some pathogenic bacterial growth. I think it's Pseudomonas, sure, but it might be another one. So what I like to do is recommend for a prebiotic alternative, a little more natural approach, is just to eat a lot of high fiber foods and try to get your, there are programs, Chronometer is my favorite, that you can enter your food and it will tell you how many grams of fiber you're getting, but try to get your daily grams of fiber above 70 grams a day, which is a lot of fiber, and you may not be able to do that unless you use some fiber supplements like chia seeds, which is a whole food, and organic psyllium husk. Organic would be important there because psyllium is frequently grown and contaminated with large amounts of pesticides. So those are two that I'm very fond of and take about 3 tablespoons of each a day, and that's why I can get my fiber and take up to about 80 grams. But that's a magnificent form of substrate so that these bacteria can multiply and grow, because their doubling time is every 20 minutes. And if they had the ideal nutrients, I mean, they would take over the planet in like a day, but of course they're limited in their growth by the nutrients. So, but this will help. I mean, you don't need much to get them to grow, and that's a big strategy. So maybe you can come on that, and we can go into some of the other components.
Okay. Firstly, the take over the planet. Yeast will do the same if you give it the right environment.
Sure. Those microbes, they're you got to be careful.
Yeah.
But we're designed to work with, it really is a synergistic ideal. It's just that when we make it artificial or do these aggressive interventions, they get out of control and it causes problems.
Just to go back to the fructooligosaccharides, the FOS, yes, it can lead to a small intestine bacterial overgrowth, but that, in my experience, is extremely rare. And again, it's about simplicity. The getting people to eat higher fiber, absolutely. Oatmeal is my favorite. I mean, it's a favorite because it's easy and because it's familiar. It's not unusual. We also have to think in terms of our cultures. What's available to you in the health food stores and in pharmacies in the USA is not quite the same as what we have necessarily in Europe. So we have to deal with what we have as raw materials. Many of the more exotic fibers that you mentioned, you'll just not find them anywhere. Or they might be too expensive or hard to resource. So the issue here for me is simplicity. I agree with you. There can be problems with FOS. I've never noticed any anyway, but it could happen.
Okay, good. So let's go on to what I think is one of the fun parts of this. And as we're doing this interview, I am in the process of writing and finishing up actually the book, my next book, which is about the mitochondrial health. Mitochondrial metabolic therapy is sort of what we're calling it. And I've been just immersed in this for the last year. It's my new passion because I think it has the potential to literally help hundreds of millions, billions of people once they understand this and integrate into their lifestyle. And it's probably the rest of my life I'll be helping people understand and implement this. But what fascinated me is because there's a supplement component to this. And if supplements are actually derivatives of food. And what absolutely fascinated me is that your list of items that you can take in supplemental form were almost identical to things that improve mitochondrial health. And I want to go over them one by one. And it just fascinating. I couldn't believe it. It was almost all the same things I'm taking anyway, but not for the reason of eliminating Candida, but for improving mitochondrial health. So let's go over the first one. You talk about caprylic acid. And caprylic acid is a short-chain fat, a derivative of coconut oil, and it's C8. And that is it's a little bit, you can actually buy it as a form of an MCT oil. Most MCT oil is C8 and C10, but caprylic acid, there is like nothing, no food source that converts more to ketones than caprylic acid. So which is a magnificent fuel for your body. So, but it also is a very important antifungal. So why don't you explain how caprylic acid can be used in an anti-Candida program?
Oh, we simply use it as one of the antifungals, which we call natural antifungals. It's to avoid using the pharmaceutical versions. We encourage the use of coconut in many forms, but I can't really expand on that because what you've just elaborated on, its other uses, is like news to me. I'm familiar with it. I'm familiar with it.
I'm telling you, this is big news, and there's a large number, increasing number of people are beginning to appreciate this, and it's power. I mean, it's been used for almost a century to treat drug-resistant seizure disorders, primarily in kids. I mean, about 80, 90 years it's been used, and very, very effectively.
Totally unaware of that, and thank you for the information. I shall look it up. But I can't really elaborate on caprylic acid except to say we use it as one of the primary antifungals when the diet alone is not doing it, and when probiotics alone are not, or in combination with probiotics, are not producing the results we want. So it's never a first line. It's always a individualized prescription if it's deemed necessary.
Well, I guess
not for the.
Okay, so the interesting component of this, if you have a Candida problem and you can use these supplements, you can benefit from the knowledge that you're also improving your mitochondrial health. And conversely, if you're seeking to optimize mitochondrial health, you're also treating Candida, which is like a double win. I never was aware that it had all these approaches had similar end target points. So the next down the list is berberine, which is another one that I'm really fascinated with, which is a very potent alkaloid, probably one of the up-and-coming supplements on the market, and it's very effective in assisting mitochondrial function. So maybe you can elaborate on its use in the treatment of Candida.
Again, it's I'm going to have to give you the same answer. Elaboration is not possible. We use Echinacea, hydrastis, berberine, tree bark you mentioned, Paudaco from tree barks. We use a variety of botanical products which in this context are used to deal with yeast overgrowth, but that they have other benefits. Double bonus, wonderful. I was unaware of.
Here's one that you're not, and hardly anyone is. I found it through an obscure scientist that had a little bit, basically 300 views on his YouTube channel. I just happened to listen to it, and I was just fascinated. And this is actually Pau d'Arco, which one of the primary ingredient in Pau d'Arco is something called beta-lactone. And what are we talking about that for with respect to mitochondrial health? Well, there is it's not a nutrient, there's a molecule, it's called NAD+, which, if you've studied biology, you'll understand is an acceptor for electrons in electron transport chain in the mitochondria. Really important. But it's also, in addition to that critical and vital function that it plays in the mitochondria, it also is an important signaling molecule. It's a sensor for stress and for disease. And the interesting thing about NAD+ is as you age, it goes down pretty dramatically, maybe 50%. And this anti-aging researchers are identifying this molecule, NAD+, as probably the primary control mechanism for slowing down the aging process. It may be the most critical one, far more important than resveratrol, because resveratrol actually hits SIRT1, but NAD+ can hit all the sirtuins. So it's really important. And this beta-lactone derivative from Pau d'Arco may be one of the most important catalysts to improve NAD+, and it's really inexpensive. So I've used this all the time. I've been using it for the last month or two, and I make up a liposomal preparation of it. But it's, again, yet another one. And I'm sure you're going to have the same response, so I'll just go on to another one that you can have, which is aloe. I personally grow about 300 aloe plants in my front yard, and I have about 2 giant aloe leaves a day I put in my smoothies. Because it's a mucopolysaccharide and it has so many powerful immune benefits. But again, it works for the mitochondria. So, are any comments on aloe in the treatment of Candida?
I do regret having to keep repeating myself.
Okay.
My focus was always in this context to deal with the yeast issue, and the fact that it has so many of these things obviously have other benefits. I'm looking at olive oil as another one, oregano extract, oregano oil. We grow that here in Greece.
Was that oregano or oregano? I mean, it's just
that's the same animal.
Okay, well, yeah, I just want to make sure. Most people, might be something different. I didn't mean to.
No. You'd pronounce it oregano. We'd pronounce it oregano. But all of these are antifungal, and that they have multiple other benefits. Olive oil, for example, we know has numerous benefits. I was reading today about new research into the benefits of olive oil. It goes on and on and on. So what really would be useful is if I could take a chapter of your new book and graft it onto my chapter and say, well, there's a double benefit here, because this is really complementary in every sense of the word. And
yes,
the fact that I'm promoting or suggesting these particular agents in an antifungal context, I've not explored their other possible benefits, and I need, if I can, to just divert slightly from where we are. I know. Sure. No,
that's fine. That's fine. We can go to have a digression. I just thought it was a very interesting.
Well, I'm fascinated, and there are another 15 things I've got to study up on. But there we are. What happened after the initial focus on yeast problems, in the mid-90s, I was writing a series of books for Elsevier in the United Kingdom on manual medicine in various forms, and I was doing some videos for them. And the one particular day, I was highly involved in tight deadlines, a lot of time pressure, extremely hot studio, and I started to develop symptoms down the left side of my body which were odd. I thought I was having a stroke. I ended up with a full tetanic contracture on the left side of my body, which was diagnosed by the neurologist who saw me as a result of hyperventilation. And I had no idea that I wasn't breathing normally. So my whole focus turned towards breathing issues, and I've spent 10, 15 years working on the biochemical effects of breathing dysfunction, which is extremely common, and many of them were identical to yeast problems. I was beginning to see how young women with yeast-related problems, many of them had upper chest breathing patterns. It's extremely common in women to have that, and these breathing pattern disorders were leading to a range of symptoms, gut symptoms, because smooth muscle constriction occurs when you're in a state of respiratory alkalosis through overbreathing. They were getting fatigued. They were getting all of the symptoms that I thought were yeast-related. Many of the yeast-type problems are compounded, aggravated by common breathing pattern disorders, not pathology, simply dysfunction. And that's where my focus has been, during which time I could, hopefully, or perhaps more beneficially, been focusing on what you're studying, which is the mitochondrial issues.
No, I didn't mean to have some superiority. It's just everything is important.
But what I was trying to explain is why I think my focus on the yeast-related problems diverted to similar problems being produced by other dysfunctions. And so when you present me with the information that I should have in my head about these wonderful other effects of the things that I've been recommending, I'm not embarrassed, but I'm irritated with myself for not having followed up on
Oh
that.
no, you just have to love yourself. That's the key. But you know, we focus on breathing quite a bit. Yeah, because you're doing the best you can. It's not like you're irresponsible. This is brand new information. There's no one in the world that's going to know everything. That's just the way it is. So that's why I love interviewing people, because they get to share their years of clinical experience, and we can get some nuggets and pearls out to everyone, including myself. But the breathing, I'm not sure if you're familiar with the Butenko breathing method, and yeah, so we've had Patrick McGowan, who is one of the leaders in the world on teaching this. He's out of Ireland.
I've met him, yes.
Yeah, so it's great. I couldn't agree more. It's a very, very powerful intervention. It can clearly help abort panic attacks and really have profound benefits on your health overall. I wasn't aware that it'd be related to Candida, but it makes not related, but very similar symptoms can emerge from both directions, and sometimes they're both happening, and you're only dealing with the one. The ideal is to deal with lifestyle, which would include enhanced breathing patterns and so on, and the dietary side. The problem is if you only focus on the diet and the obvious yeast overgrowth, and you don't deal with what might be feeding into it from what is an extremely common problem, you miss part of the story. Okay, that makes sense. Well, if you have been listening and watching this and been intrigued with the information and feel that you may suffer from a yeast overgrowth, and as I said, if you're not leading a really healthy lifestyle and engaging in some of these other foods that we've been talking about, or not engaging but consuming them, then there's a good likelihood this Candida, which is really present in all of us, may have grown to the point where it's a parasite and really causing you symptoms that are taking away from your health. So there's certainly good information we provide in here, but it's a more comprehensive approach in Dr. Chaitow's book that you can pick up, and the name of that book is Candida Albicans. Is that the correct name? And okay, so and then it's available on Amazon, and you're in the 4th edition of it now, and it's a pretty solid book that summarizes it very, very well. It's sort of an update to Dr. Crook's book, and you may want to pick those up at the library. They may even still be publishing it, but Dr. Crook was a prolific writer. He wrote many, many books on this topic, and then Dr. Ryan Trust, I believe, was one of Dr. Crook's mentors. So these are the two pioneers in this area, and they both have since passed away. But
yes, I think both the Missing Diagnosis by Truss and Dr. Crook's book, The Yeast Connection, they're both still available on Amazon.
Okay, great. And your book is another sort of an updated version, because as I said, those individuals are no longer with us. And as far as I recall, I just may be ignorance at the point, but I don't believe Dr. Crook went into some of the natural therapies. I mean, certainly caprylic acid and oregano. And interestingly, I've got a massive oregano bed that I have every day. I just like 8 ounces of oregano and just put it in my salad. So fresh is best, I think, and especially if you can grow it yourself. Oh, one point on the olive oil, you've got to be careful. You're in Greece, so it's not as big of an issue, but in the United States, 60 Minutes earlier this year did a massive expose on the Italian mafia with respect to olive oil. They're making $15 billion by adulterating it with safflower oil, a really pernicious, highly oxidizable omega-6 refined vegetable oil that is adulterated 80% of the olive oil in the U.S. 80%. I will not buy fish canned in olive oil because it's like almost 100-to-1 guaranteed it's going to be an adulterated oil because they're going to use the cheapest one.
You're absolutely right. We have very low acidity oil here. It's from our own olive trees, and believe me, we know very well what's happening with the world of they buy olive oil from Greece, they take it to Italy, they adulterate it, they add other stuff to it, and they sell it off as pure virgin olive oil, which it isn't.
So if you can get the real thing, I mean, you're going to pay more for it. So, and some of the big brands like Costco, I could think in the United States, is one that's pretty good about making sure that they're their products that they sell are not adulterated. But if you're not getting it from there, you're really confident. You have to be very, very careful. Or if you can live in Greece and pick your olives. You know, I've got an olive tree in my backyard. It actually has a lot of olives, but I've just never figured out how to harvest them and process them and turn them into olive oil. I got to figure it out one of these days.
I'll send you a diagram.
Oh, well, definitely do that. I would really appreciate that. I think we covered it pretty well, unless there's anything else you'd like to add to it, or any website that you have to refer people to, or
it's www.leonchaitow.com, leonchaitow.com. But the probiotics themselves, just be careful of what you're buying. Unless it states on the bottle the actual amount that's going to be in it at the time of opening, not at the time of manufacture, be careful of what you're buying, because you've got problems there as well. People are selling dead material.
Yes, indeed. And we've got the quality is always the key. And, you know, we definitely sell supplements and natural health resources on our site, and that's our primary focus, to make sure it's the highest quality possible, because it's just not worth it. I mean, it may cost a little bit more, but, you know, buying inferior products is going to save you a little bit of money, but ultimately it's going to cost you a heck of a lot more in your health, and no one needs that.
Okay. Well, I hope our discussion has given you something to use.
Yeah, everyone, I would agree, and thank you for helping, for sharing your insights for many years of helping people get better with this problem.
Thank you very much for having me. Cheers.